Okay, now I have focused the right kidney of the patient. That is showing dilation of all the calyces, minimal dilation of all the calyces with preserved parenchymal thickness and corticomedullary differentiation. Here you see the ureter is dilated. This is the dilation of the proximal ureter, and it is dilated up to approximately 9.9 mm. Normal is up to 7 mm. So obstructive uropathy on the right side. Now when I come to the cause of it, this is the urinary bladder. Okay. And you see there is a calculus in the right UVJ, uretrovesical junction here. And this one. This is the urinary bladder, and this is the calculus within the right uretrovesical junction. And if we concentrate, it opens into a tube-like structure. Here, this tube-like structure, but other tubular structure, at the tip of which where it is the, now this is the in transverse, this is the transverse view of the urinary bladder, and you see that this is the urinary, this is the calculus location. I have shown you now the measurement approximate. Here it measures 8.1 mm. So this is the accurate measurement for the urinary bladder. Now this area, this one is not any significant pathology. It is just a dilation of the left UVJ. And here on the right side you see the calculus. Okay, now this is the cause of obstructive uropathy, dilation of the ureter and the hydronephrosis that we have seen. Now in this patient the uterus has been removed surgically, and this is the vaginal stump. This is the vagina, and this is the vaginal stump. Now from this region, almost so difficult to separate it from the urinary bladder. Now this is the urinary bladder with the stone. This is the cystic area, internally clear of any septa, debris or calcification, measuring approximately 57 by 53 millimeter. This is the vaginal stump. This is the urinary bladder. Now there is a breach, you see, if you concentrate, there is a breach between these two cysts, and this area is in fact consistent with either a cystic structure relating to the vaginal stump because of a loose stricture when the suture was placed during the removal of the uterus. However, it can also be a diverticulum. See, there is a breach in this region. This is the urinary bladder, and between these two cystic areas, this breach is suggestive of the fact that it can be let me show you. This can be a diverticulum, most likely. Now on the right side, there are three cystic areas seen. This is the cystic area number 1, urinary bladder. This is the cystic area number 2, diverticulum, and this is the cystic area, thin walled, internally clear, but with few septals. You see, it does contain few septals. Let us study this one. This cystic area, now I'm going to give a sweep to it, 180 degree. It does not change its shape, it retains its shape, is thin walled, shows posterior wall enhancement. This is the posterior wall enhancement, and a typical picture of a cyst. This is right adnexal, or we can say an ovarian cyst, measuring 52 into 72 millimeters. So this is an now in this study, what we have seen is that now you see these are the ovarian, the iliac vessels. This one. So in this case, we have seen three study areas. One, urinary bladder with a calculus within it. Then a cystic area protruding laterally. This is the area with a breach between the urinary bladder, and this is a diverticulum of the urinary bladder, or a cyst relating to the vaginal stump, and this is the third one, which is the ovarian cyst, simple ovarian cyst. Now to rule out whether which one is the cyst and which one is the urinary bladder, what we do is we ask the patient to urinate. The urinary bladder will collapse, rest will remain. So I'm going to ask the patient to urinate. I presume this one will disappear, and these two structures, cystic structures, will remain here. इसमें pause कब करना है? So let's see after she urinates what we find, and after that.